Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk today about gum recession, the causes of gum recession, treatment for gum recession, specifically the pinhole technique for gum recession. So, what is gum recession? Well, gum recession is when the gum moves away from the tooth, so more and more of the tooth starts to show. The root of the tooth starts to show. And this can lead to increased sensitivity, a unacceptable or a smile that's not very attractive. And as the gum continues to recede, the tooth may be more subject to decay. As the gum recedes, the bone recedes. And you know, if you continue to lose gum and you continue to lose bone, the tooth really becomes at risk, and you actually risk losing the tooth. So there's lots of consequences to untreated gum recession. So let's talk about the causes of gum recession. Well, one of the primary causes is genetics. If you inherit, genetically, if you inherit thin gum tissue, that thin gum tissue is much more likely to be subject to recession than someone who has thicker gum tissue. Another cause that I frequently see, I would say probably 70 to 80% of the patients that I see for recession have had orthodontic treatment. And sometimes that recession doesn't occur till a month, a year, 2, 5, 10, 20 years after the orthodontics. But very frequently, the orthodontics has an effect on the bone and the gum that sets the stage for recession in the future. Another major cause, vigorous toothbrushing. Most of the patients that I see are very, very conscious of how clean their mouth should be. And they're super duper cleaners. They may brush their teeth 3, 4 times a day, really scrub them. Well, the more you scrub, if you over scrub and if you over clean, you're actually traumatizing that tissue and causing it to be more likely to recede in the future. Also, if you clench, you grind your teeth, that can be a factor. If you have fillings, that can irritate the tissue and sometimes cause recession. I had a patient the other day who had recession after she had used a whitening strip to whiten her teeth. So sometimes the chemicals from whitening materials, strong chemicals, can actually cause gum recession. So those are some of the frequent causes that we see when we see gum recession. Traditionally, in repairing areas of gum recession, periodontists take tissue from the palate. Now that can be pretty uncomfortable. It can be pretty painful, actually. Cutting gum tissue out of the roof of the mouth is really what it is. Plus, you can only do a limited number of teeth because you can only really take out a certain amount of gum tissue from the palate at one time, actually. Of course, it's limited. So I use the pinhole technique exclusively, virtually exclusively. I never take tissue from the palate if I can possibly avoid it, which is almost all of the time. So here's an example of a situation where a young man came in. He had had recession on the back of one of his lower front teeth. Now, a periodontist, twice in the past, he had been to periodontists who tried to repair this with what's called the gold standard, which is taking tissue from the roof of the mouth and trying to cover the recession with that. Both of those attempts failed. He came to our office, and it was an interesting challenge, and we did it with a modification of the pinhole technique, and we got a very gratifying result, much better, and the patient, of course, was much happier than what had happened in the past. Now, we also had another patient who flew in from South Korea. She wanted to have her recession treated. She was an American citizen but lived in Korea. She flew in to see me. We did her whole mouth at once. Again, we didn't take tissue from the palate. You really couldn't treat the whole mouth by taking tissue from the palate anyway, because you couldn't get enough tissue. So we did the pinhole technique, which is minimally invasive, usually little or no pain or discomfort. It's really great. It's worked so well for me and my patients. We did her whole mouth. This is what it looked like before, after. The result is great. She was extremely happy. We were extremely happy. And it's very gratifying to be able to help patients like this who've got gum recession, some of whom have been through previous treatment that hasn't worked, that it maybe has failed, and then we can very often help them and treat those areas effectively with minimal discomfort and maximum effectiveness. It's a great technique, great procedure. So if you have gum recession, don't hesitate to give us a call. We'll take a look and see if we can help you. We probably can. And if you have any comments, make sure and let us know. We want to keep you informed, keep you happy, keep you healthy, because if you have a healthy mouth, you're going to have a healthier body. Take care. Have a great day.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.